Hello, everybody. Thank you so much for tuning in today. This is the Bodega Cat Book Club Health Edition. And today we're continuing our reading of Vibrational Medicine by Dr. Richard Gerber, MD, medical doctor. So the subtitle is called The Number One Handbook of Subtle Energy Therapies. And the book that we're using is the third edition. So this particular book was inspired by a quote from a famous scientist. Sorry about the glare there. His name was Nikola Tesla. If you don't know who he is, I encourage you guys to check him out on YouTube. It's Tesla, like the car. I don't think they're related. But anyways, he said many years ago, and I'm paraphrasing, that if you want to understand the universe or know the secrets of the universe, you have to understand vibration, energy, and frequency. So that was what inspired the reading of this book. So before we begin, I want to welcome everybody for being here today. If you like what we do here, do consider checking out our other book clubs. We have our spiritual book clubs on Mondays and then financial book clubs on Thursdays. And we put all the books that we've read, all the past books that we've read, as well as our current ones on YouTube. So you can check out our YouTube channel. We have them on a playlist, so you guys can just download it and listen to it when you're walking your dog or when you're stuck in traffic or when you're jogging or whatever. Um, and we have other contents on there as well, not just the book club. So please do check them out and like and subscribe. And what else do you do there? Comment and all that good stuff. If you have a book that you would like us to read, that you would like to recommend for us to read, I'll leave a link in the description box below for you guys to fill that out. And we'd love to hear from you. We'd love to hear what is in your library, what makes you, what inspires you, things like that, and share it with the community. We also have a free monthly newsletter that we put out, so please do consider subscribing to that as well. And if you want to support us further, you can buy me a coffee, leave a donation, and check out our merch. We have many different merch for your fur babies, for your kitties and doggies, as well as humans. And we're always updating, our old designs and coming up with new designs. So come back often and check them out. And lastly, if you're in the Los Angeles area or if you're visiting LA, come visit us in a healing center. We have a healing center that we use technologies based on Nikola Tesla's, the scientist that I spoke of earlier, based on his scalar wave research for holistic healing for both domestic animals and humans. So you can read all about that technology on our website, as well as our other services that we provide as well. So, however way, shape, or form that you guys support us, we appreciate it very, very much. But most importantly, thank you for being here. Thank you for being on this book club journey with us. I think that, reading is a lost art. And, I hope to revive it just a little bit, and share some of the timeless wisdom that we have in our libraries through books and stuff. And so kudos to you guys for sticking it out and staying with us. So pat yourself on the back. Okay, so this is, let's see what chapter this is. This is chapter 6, and this will be part 2. And I hope you guys are enjoying this reading. It's a little dry for my taste. Excuse me. I think it's because, the author is a medical doctor, and sometimes they have like big words. I don't know. Big words might not mean, you're smarter or whatever. And it's sometimes you don't understand big words. So just speak English. Anyways, otherwise, I'm enjoying it. I really love the information that he's putting out there, especially the non-physical aspects of our of who we are as a human being, right? Because we are multidimensional in many different ways. So, anyways, okay, let's do it. So this is again chapter 6, part 2. EAV and environmental illnesses, a new look at clinical ecology. The Volt device has great value in matching homeopathic remedies to patients, but its value goes beyond this particular facet of application. The meridian-based technologies are able to reveal much about the energetic and physiologic status of the individual from many different perspectives. These systems employ the acupoint resonance effect to examine a wide variety of energetic disturbances in the individual. One area of increasing interest has been the application of Volt techniques to study the ill effects of particular environmental agents. Studies in this direction are part of the growing field of clinical ecology. And there is an endnote here. We won't read the endnotes in this for this particular book club, but if you have a book, you guys can do it and wish to do a deeper dive into it, you're welcome to do that. But just for our purposes here, I'm just going to mention it. That's about the extent of it. Okay, I hope you guys can read that. Ah, okay, that's better. Okay, pioneering workers in this developing field have done much research to show that common environmental substances may produce unseen ill effects in humans. If asked about environmental agents which adversely affect human health, most individuals tend to think about toxic waste and industrial chemicals. More recently, it has been shown that the list of substances affecting us includes many more items than those which are byproducts of industrial manufacturing. As civilization has become widely industrialized and technologically advanced, humans have come to accept life in a chemical-filled environment. Most research on adverse effects of hazardous substances in our environment has focused on the carcinogenic influences of long-term chemical exposure. Standardized methods involved giving huge doses of suspected chemicals to laboratory animals over short periods of time in hopes of stimulating the biological effects of long-term micro-exposure. Other tests involve measuring the mutagenicity of similarly suspected chemicals in their ability to cause chromosomal alterations in the bacteria. The relevance of extrapolate. Oh, okay, extrapolating. I think that's how you pronounce that. Extrapolating. This type of data to human beings has been brought into question by a number of different groups. One problem with studying the adverse physiologic effects of chemicals is the traditional scientists' inability to measure subtle changes in human beings. Certain chemicals may induce subtle abnormalities in behavior and mental alertness. Some agents may induce headaches, body aches, and other nonspecific symptoms, which cannot be as measurably quantified as the tendency toward cancer cell production. Research by workers in the field of clinical ecology has demonstrated that many people are adversely affected by exposure to unnoticed factors in the home and work environment, such as synthetic plastics and natural gas. Of more recent interest have been the ill effects produced by certain substances contained in foods. Food dyes, additives, and other controversial agents have received much attention in the news media. It is becoming increasingly evident that there are now many synthetic and naturally occurring agents in the foods we eat, which cause a variety of abnormal physiological effects. Many of these adverse effects are subtle and frequently ignored by doctors because of their inexperience in this field. In regards to food allergies, most physicians only recognize physiologic mechanisms involving the classical IgE-mediated pathways of the immune system. IgE, immunoglobulin E, is a special type of antibody which causes the release of histamines and other allergic mediators from tissue mast cells when stimulated by specific evocative antigens. The symptoms most commonly produced by IgE-mediated food allergies are the familiar symptoms of wheezing, itching, skin rashes, etc. These symptoms are among the common responses evoked by histamine and other immunologic mediators of allergy. The problem of abnormal physiological reactions to agents in food is of greater importance than is currently recognized by the medical establishment. One of the reasons for doctors' inattention to this problem is their lack of understanding. Most physicians cannot comprehend and thus do not believe the substances can evoke adverse physical reactions in the body without involving the familiar IgE pathways of the immune system. The wide spectrum of symptoms caused by food allergies is due to classical allergic phenomena, as well as sensitivity reactions mediated by non-IgE immunologic and other subtle physiologic pathways. One tool which has been sensitive enough to evoke diagnostic information about these sensitivity reactions has been the Vol machine. One of the pioneers in the field of linking EAV technology to clinical ecology is Dr. Abram Burr of Phoenix, Arizona. And there is an endnote about that, about Dr. Burr. Working with the Vol machine, Burr has been able to apply the discoveries of other researchers in the clinical ecology field toward rapid diagnosis and treatment of treatment of food allergies. One of the primary sources for Dr. Burr's diagnostic application is the research of Dr. Robert Gardner, and there is an endnote for him as well, of Brigham Young University in Utah. Dr. Gardner discovered that many allergies were caused by sensitivities to certain aromatic chemical compounds found naturally in all plant food and pollens. These pollens. These plant-associated compounds, which contain aromatic or phenolic groups derived from the benzene ring, were later discovered by other researchers to occur in all foods. It has been suggested that these compounds are not allergic antigens, but that they act as haptens. A hapten binds to other naturally occurring substances in the body, thereby changing its appearance to the immune system. The old familiar protein or membrane structure, now combined with the new phenolic hapten, is no longer recognized as a part of self and thus induces adverse immunologic reactions. A common example of this type of reaction is penicillin-induced hemolytic anemia. In certain sensitivities, in certain sensitive individuals, penicillin acting as a hapten binds to the red blood cell membrane and changes its appearance to the immune system so that it is no longer recognized as a familiar component of self. The penicillin/red cell complex induces an antibody response, which ultimately results in the destruction of the red blood cells via a rupturing of their external membranes by immune attack. Immunologic changes which occur as a result of exposure to phenolic compounds include reductions in the number of T cells and T suppressor cells, a subgroup of T cells. And there's an endnote about that. This reduction in T cell number is reflected in an altered T to B cell ratio. T cells are special lymphocytes which attack and remove cancer cells, viruses, and fungi. A particular type of T cell, known as the T suppressor cell, works to keep the immune system from attacking the body itself. B cells are another type of lymphocytes which produces antibodies. There is usually a particular ratio of T to B cells that reflects a normal portion of immune components. Immunocompetence is partly a reflection of this special balance in types of lymphocytes. Certain phenolic compounds have been associated with changes in this T to B cell ratio. Similar immunologic alterations in T and B cell ratios have been seen in the AIDS syndrome and other immune deficiency syndromes. Reduction in T suppressor cells has been noted to occur auto in certain autoimmune diseases. This is not to imply that phenolics are the cause of these diseases, but that the types of alterations in immune function seen in response to phenolic exposure have been associated with significant illness. Other physiologic changes produced by phenolic compounds include cardiac stimulation and rapid heart rate. This appears to be due to the phenolic compound's effect on increasing the body's responsiveness to catecholamines, a class of adrenergic neurotransmitters, which includes adrenaline and dopamine. Additional changes induced by phenolic compounds include depressed serotonin levels, elevated histamine and prostaglandins, and abnormal immune complex formation. From a clinical perspective, research on foodborne phenolics has demonstrated their ability to induce behavioral disturbances in children, including the hyperkinetic syndrome. And there is an endnote about that. The classical clinical ecology method of testing for sensitivity to phenolic compounds involves a technique known as sublingual neutralization. In this technique, several drops of a 1% solution of the suspected phenolic compound are placed under the tongue of the patient. Following the phenolic challenge, various parameters of physiologic and mental function are tested. A positive response is felt to consist of a change of pulse or blood pressure, acute symptom onset, or changes in the mental status of the patient. Once a reactive phenolic substance is discovered, the compound is presented to the patient in a variety of dilute solutions to find the concentration, which will neutralize the induced symptoms. Progressively more dilute solutions are tested until a reversal of symptoms occurs at what is referred to as the, quote, neutralizing dilution. The patient is given a bottle of the phenolic compound prepared in the neutralizing dilution and is instructed to place 2 drops under the tongue 3 times a day. Retesting is then necessary in the same manner as the initial potency loses its effectiveness over time. Excuse me. Similar tests at a later date show that the patient needs a change in the concentration of phenolic compound to achieve the same beneficial effect. The patient is switched to the new neutralizing dilution of phenolic, and the process is repeated again and again over the course of many months. There are obvious similarities to classical allergy desensitization, except that the testing methods are different and the patient is given sublingual drops instead of shots. The initial testing procedure can be quite time-consuming and may involve many hours and days to test a large panel of suspected phenolic compounds. Because of this, Dr. Burr sought to improve the efficiency of diagnosis by utilizing the Vol machine in testing for phenolic sensitivity. The procedure involved is quite unique in that it allows testing of a variety of compounds at various dilutions in a matter of 20 to 30 minutes. The phenolic compounds are prepared in a series of dilutions which follow a type of homeopathic rationale. The first dilution consists of a 1:5 ratio made from 1 part of the original phenolic and 4 parts of distilled water. The second tincture, referred to as dilution number 2, is a 1:5 dilution made from the first tincture. The third dilution is prepared by a 1:5 dilution of the second tincture, and so on. This process continues up to the 40th tincture, at which point the dilutions become 1:10, usually up to the 60th. As the dilutions go up in number, there is progressively less and less physical substance of the phenolics actually present. A 40th dilution should contain 5 to the minus 40, or 1.1 times 10 to the negative 28 times the number of phenolic molecules which were present in the original phenolic solution. This is considerably less than Avogadro's number, 6.02 times 10 to the 23rd, 10 to the negative 23rd, the number of molecules in a mole or gram molecular weight of a chemical. Hence, there is less than a single molecule in the 40th dilution. The phenolic dilutions prepared by Burr are actually homeopathic remedies in that the majority contain not so much the physical material, but the energetic signature of the phenolic compound. Dr. Burr has created a special EAV testing setup, which consists of an open wooden stand with multiple metal-lined shelves. The metal base of each shelf has an electrical connector, which allows one to plug in a wire from the Volt machine. The metal shelf operates in a fashion similar to the EAV metallicness accessory table. Thus, multiple remedies placed on a metallic shelf can be tested simultaneously. Groups of remedies of the same levels of dilution are arranged on their own special metallic shelf units. By plugging the wire from the Volt machine into the metal bases of different shelves in a sequential fashion, whole groups of remedies can be tested simultaneously for acupoint resonance reactivity. If a shelf of compounds tests positive via an acupoint resonance reaction with the patient, a process of progressive elimination is employed. This consists of individually testing each substance on the reactive shelf until the guilty substance is identified. Once the reactive substance is discovered, progressive retesting with various dilutions of the substance is done via acupoint resonance until the exact neutralizing dilution is pinpointed. The types of substances which make up Burr's first group of phenolic compounds, phenolic compounds include gallic acid, which is found in up to 70% of foods, APO, cinnamic acid, coumarin, indole, phenylalanine, ascorbic acid, and others. The second group includes many neurotransmitters or precursors to their synthesis, such as choline, dopamine, histamine, serotonin, tyrosine, neuropinephrine, and a number of others. Regarding reactivity to the second group of phenolics, it is unclear whether patients are sensitive to these agents in ingested foods or whether the Volt machine is picking up an internal difficulty with these particular transmitter systems. The second hypothesis is probably the more likely, but the symptoms associated with reactivity in these phenolic substances still revolve with sublingual use of neutralizing dilutions. The remarkable thing that Burr has discovered in using the Volt machine is that a variety of syndromes found to be untreatable by conventional drug therapies appear to be caused by sensitivity reactions to common phenolic compounds. Confirmation of this hypothesis is suggested by relief of these symptoms following the use of sublingual doses of neutralizing dilutions of the suspected offending phenolic. For instance, reactivity to gallic acid, perhaps one of the greatest offenders, has been linked to back pain, lower back pain, sciatica, chronic severe chest wall pain, musculoskeletal aches, and chronic fatigue. As mentioned before, gallic acid is found in nearly 70% of all foods. It has also been linked with hyperactivity and learning disabilities in children, and is found to exist in many food coloring agents. Removal of food dyes and additives in the diet of such afflicted children as in the Feingold diet may relieve hyperactivity by the avoidance of gallic acid. Burr has found sublingual neutralization to be as effective in decreasing hyperactivity as the avoidance diet, and it is easier for the children to follow. When the offending phenolic compound is isolated and the proper neutralizing dilution discovered, relief of symptoms following sublingual administration may result in dramatic relief in symptoms. Burr discovered that if patients were experiencing pain-related symptoms at the time of EAV testing, sublingual presentation with the neutralizing dilution frequently caused significant symptom improvement and relief within approximately 10 minutes. Another common phenolic-related problem is found with reactivity in coumarin, a compound found in at least 30 foods, especially wheat, cheeses, beef, and eggs. Burr discovered that the majority of asthmatics tested have coumarin sensitivity. Neutralization of this particular phenolic frequently results in a significant improvement. Oops, sorry about that. Frequently, it results in a significant improvement in the patient's asthmatic reactions, as evidenced by a reduction in the need for bronchodilator medications. Coumarin has also been found to contribute to arthritic symptoms, cervical and lower back pain, and digestive disturbances, particularly bloating. Abdominal distension due to coumarin sensitivity can be so severe that patients may be unable to fit comfortably in their clothing within minutes of eating a coumarin-containing meal. Bloating after meals is a frequent complaint made by patients to their doctors. Physicians currently have little to offer other than gas-absorbing agents, such as simethicone, which are often ineffective in relieving this patient's symptoms. The frequency of the symptom of bloating may suggest how common sensitivity to coumarin may be in the general population. Another phenolic substance that Burr has found to be problematic is the amino acid phenylalanine. Oh boy. I wonder how they come up with these names. Some of them are pretty tongue twisting. All right, let me try again. Phenylalanine. Burr feels that although most patients do not have the classical intolerance for this amino acid seen in the newborn disorder of PKU, phenylketonuria, a genetic inability to handle phenylalanine. Many people may have a subclinical form of intolerance, which is unrecognized. Burr has found phenylalanine sensitivity to be associated with hypertension, headaches, respiratory diseases, and collagen disorders. Most interestingly, he has noted significant lowering of blood pressure in hypersensitives, lowering of blood pressure in hypertensives, which is high blood pressure, with phenylalanine sensitivity when they are presented with neutralizing dilutions of amino acid. This list of reactive substances goes on and on. The variety of common, often non-specific complaints such as headache, back and neck pains, and chronic fatigue make one realize how helpless conventional physicians may find themselves when conventional drug therapies do little to relieve these problems. Many of Dr. Burr's patients have found significant relief in his neutralizing drops when other doctors fail to offer even palliative drug effects. The widespread nature of these substances in the food we eat and the potential unseen ways we are affected gives greater impetus for the use of energy-sensitive devices, such as the Vol machine, which offer unique diagnostic capabilities. The meridian-based technologies, though currently unaccepted by the mainstream medical establishment, are slowly beginning to find their way into many physicians' and dentists' offices. In recent years, the Food and Drug Administration authorized at least 150 experimental research licenses to orthodox medical practitioners who wish to explore the use of the Vol machine and EAV technologies in diagnosis and therapy. This is a sign that there is slow evolutionary change occurring within the medical field, and the devices like the Vol machine may eventually find their way into widespread use by healthcare professionals within the next 10 to 15 years. I think we're beyond that. We'll stop here for now, but let's see when this book was published? Let's see here. It was published in 2001. So 10 years would be 2011. Well, okay. 15 years, 11, 12, 13, 14, 15, 16. Yeah, we're way beyond that. We're 2026. So we're slow, isn't it? We're still slow to accept. But one of the things about the food that he was saying, um, a lot of the doctors and even, homeopathic and naturopathic modalities, they still, in a way, treat the symptom. But in my opinion, the root cause is really the food, the soil that we use, or the herbicide, pesticides that, the farmers used to, um, and the GMOs, the genetic modified food like corn or soy and things like that. Those are the root cause. In the 50s, if you think about it, 40s and 50s, people are not fat. They eat, they don't have, they don't categorize food as organic, non-organic. They're just food because their food um, it's just natural, right? There's no chemical, no nothing. It's just food that you grow in the ground and you eat. It's just very simple. We just made it more very complicated. I think human beings have a way to make things complicated, and I don't think it should be that way. When you think about nature, Mother Nature, how Mother Nature works, how the universe works, how life works, it's very simple. It's so simple. It's like, duh, hello. And we have to kind of get back to that. Common sense, simple. So anyways, that's my thought. What do you think about this little section here? I hope the section about the chemical that kind of went over my head because I'm not a but for those of you chemistry nerds out there, I hope you enjoy that little section there with all the chemicals and stuff like that. So anyways, I hope you enjoyed that. Let me know what your thoughts are, what you think, and I love to hear from you and see what you think about what we read and maybe the book in particular in general and things like that. Leave your comments in the comment below and we'll see you next time in our next book club. Okay, bye now.